Respiratory is the renewed treatment of tuberculosis. Approximately 42,000 new cases of tuberculosis were reported in Japan in 1997. That marked the first increase in 38 years. Tuberculosis cannot be called a disease of the past any longer. Tuberculosis is a contagious bacterial disease that usually affects the lungs. In many cases, the body's immune system destroys the bacteria before it does much damage. Only a scar or spot is left on the lungs as if, evidence of the infection. Sometimes, however, the infection spreads and causes a variety of symptoms, including coughing, fatigue, fever, sweating at night, loss of appetite, and weight loss. The bacteria may also pass from the lungs through the lymphatic system to the bones and joints, kidneys, or brain and the spinal cord. Occasionally, the bacteria remain dormant in the lungs for years, flaring up again to do further damage. Left untreated, tuberculosis may eventually cause death. A tuberculosis patient is usually treated with 2 to 4 anti-tuberculosis drugs. There is multiple drugs administered in that this helps overcome the danger that the bacteria may develop resistance to one of the drugs. The drugs act either by directly killing the bacteria or by preventing them from multiplying. Some anti-tuberculosis drugs may cause adverse side effects, such as nausea, vomiting, and abdominal pain. Because of this, special care is needed when taking these drugs. Drug treatment normally continues until the symptoms have subsided and laboratory investigations, such as sputum tests, have shown the person to be clear of infection. The treatment usually takes a long time, sometimes more than a year. Con- conditions in the Conditions in Japan now suggest that the nation is at a critical point in its fight against tuberculosis. There has been a fast increase in the number of patients infected by multiple drug-resistant strains. One reason for this is that many tuberculosis victims didn't complete their treatment, and consequently the bacteria that remained became resistant to current medications. Now a great deal of research is underway to develop drugs effective against more drug-resistant tuberculosis. It is hoped that the advent of such drugs will represent the final victory in the fight against this stubborn, troublesome disease.